Good day once again, this is Doc Daryl and we're going to discuss about the cardiovascular system. Forgive me before anything else, I know there's a background noise because I think it's really summer and I don't really like hot weather. Usually whenever I make recordings or I record our lectures, I make sure that the air conditioning unit is not working. I mean, it's turned off because I know it's annoying to hear a background noise, but for now, I can't really tolerate it. So, please, I am very sorry. Okay? But anyway, let's start. The cardiovascular system in front of you it's actually a picture which represents, as you can see, it's like a highway with the highway is the blood vessels, and then the cars are the red blood cell here based on the picture now, and the one that regulates the traffic is actually the heart. Okay. Anyway, cardiovascular system consists of three interrelated components. That's why I was not able to send the entire PDF to you because it's very very long. I will summarize it and just focus here in based on the slides that I'll be giving. Okay, I will summarize it as I hope that it's not too much no for you to learn, but I hope it's also enough. I'm also planning to lecture if ever you allow or if you want, but it's not really necessary for me to discuss about the ECG. So I asked few of your classmates if you want to inform me, give me a feedback so that I could make a slides for according to your level. Okay, because I have slides, but it's usually for lectures for doctors and for nurses. So I'll fix that. Okay? Anyway, the three components that I was talking about are the blood, the heart, and the blood vessels. As you know, this is one of the topic, no? Here is a picture of the red blood cell and white blood cells and so forth. Usually, we mentioned this before that the blood contributes to the homeostasis by transporting oxygen, carbon dioxide, nutrients, and hormone to and from your different body cells. Okay? Also in this topic, we'll be talking about or we'll be exploring the structures of the heart and unique properties that permit it from pump for a lifetime without rest. As maybe I'll just this topic about the conduction system is not, we won't focus too much on that because it's for higher levels, but I'll give you an overview. Okay? Later you'll know what I'm talking about. Anyway, also the blood vessel actually contributes to the homeostasis in this part, no, of the body of the or the system by transporting and distributing blood throughout the system, as I mentioned earlier, and carry the waste away. So they help together with the this. I'm actually talking about the blood vessels. So as they work together to make this function or this homeostasis process possible. Okay, so let's start with the blood. Here are the functions of the blood. The first one is for transportation, then regulation, then protection. So for the transportation, the blood transports oxygen from the lungs to the cells of the body and carbon dioxide from the body cells to the lungs for exhalation. So I'll just repeat that, okay? So it transports the oxygen from the lungs because that's our way of inhaling. No, we inhale and exhale for the lungs to get oxygen and other actually we inhale all of the things, no, but we only need the oxygen. Then as it goes to the very thin layer of the lungs, the oxygen is being absorbed by our blood vessels, by our then to the red blood cells from the lungs. Then it travels towards the other system to be used. Then once that the carbon dioxide is also produced by the cells, it's being carried from the cell or from the organs towards the lungs to be exhaled. Okay, I hope that's clear. It also carries nutrients, as I mentioned earlier, from the gastrointestinal tracts. It depends if we'll be talking about this soon. And then also hormones, as we mentioned about the endocrine glands. And also the blood transports heat and waste products to various organs for elimination from the body. Remember our topic about the cell during the the introduction, I think, or maybe during the when I was talking about the homeostasis. Blood is one of the components. So another function is for the regulation of pH, circulation. Somehow it's for regulation. So the circulating blood actually helps maintain the homeostasis of all body fluids. It also helps regulate, as mentioned, the pH through the use of buffer. I will not talk about this because it's not part of the system. But anyway, the buffer are chemicals that convert strong acid or bases, into weak ones. I hope you remember the one of the topics, no nga. It's somehow not related, but remember about the pH. So the neutral pH is 7, and so like that, no. We'll be talking about that soon. But we talk about that. I hope we'll be talking more about that during the GIT lecture. But I hope you know what I mean, that it regulates the pH so that it won't be so acidic and not so basic. It transports the excess ions. Later we'll know. I hope I could discuss that. Okay, even just for few minutes. Anyway, it also helps adjust body temperature, as we mentioned earlier, and absorbing coolant and properties of waters and so forth. Also, it helps in the osmotic pressure, which is actually influenced through the absorption and excretion of waste. But later we'll discuss about that. Okay? Also, one of the function of the blood is for clotting. So, blood can actually clot, become gel-like, which protects against the excessive loss from cardiovascular system after an injury. So, it's our purpose as well, no? The function as well of the blood, to make sure that we won't lose a lot of fluids and even blood itself. It also has a white blood cells that protects against diseases by carrying on the process of phagocytosis. As I think most of the topics that we're discussing is like being talked by previous. We already had some examples before, right? So I hope you still remember those. Okay. Anyway, those are just for the function. You can just memorize this if ever, no, for you to know the basic functions of the blood. Here is a picture. I actually got this from the internet, no, for you to know. This is usually a machine or an equipment used by medtechs. It is what we call centrifuge. They place the blood and it turns around, no, and then later, after the right one, I was supposed to have an effect here. I forgot to place it, no, but anyway, focus your picture on the right. Your attention on the right side, the right picture. That's the centrifuge. You place the blood that you extracted from a patient, if ever, no, for medtechs. They usually place it there, then it turns around for a few minutes. I'm not really sure about the timing or so, if there are small for how many minutes or so, but after a while the output will be the one on the left side. Okay, the one with the yellow and the red color. This is the blood, no? It consists of the yellow, which is the plasma, about 55%. Then the one between the yellow or the clear, the I don't know how to describe color. I'll just call this yellow, okay? I know you may call it amber, or I don't know. I'm not really sure with the colors, but the yellow, then there's something in the middle, then the red. The one in the middle is the buffy coat. Okay, it's composed of white blood cells and platelets. It's a very thin line. Then below the red one is actually the red blood cell, which is around 45%. Okay, so it's the plasma 55%, then red blood cell is the 45%. This is a division for you to know. As you can see, I'll just mark it here. I want you to know that this is for the body weight. The entire body weight of a human, 8% of it is the whole blood, Then the other 92% are other fluids and tissues. So 8% is significant just for the whole blood alone, no? And then the whole blood is divided into, sorry, I clicked the button. The whole blood is divided into blood plasma, which I mentioned earlier, it's 55%. Then the rest is the formed elements are composed of 45%. Let's focus first on the plasma. So the plasma, out of the blood plasma, 7% is protein. Then the water component is 91.7%. And then other solutes is actually 1.5%. For the protein, the most common protein is the albumins. So it's 54%. Globulins is 38%. Fibrinogen is 7%. And all others is 1%. No, I just want to emphasize, albumin is 54%. Later, maybe as we progress to our maybe fourth years, you will understand why. But this is correlated with diseases. Okay. And then also for other solutes, those are the electrolytes, nutrients, gases, and the rest. No, it's not really that important for us to know for now. Then for the formed elements, as I mentioned, it's 45%. The platelets usually is 150,000 to 400,000. That's the normal value. So whenever, but it depends on the laboratory. No, sometimes some laboratories will use a different value. Just follow their values as a doctor in the future, because machine per machine may have different value. I'm not really sure with that, but usually whenever just say for example, I don't know if I shared that my brother-in-law had dengue. That was that was last year, I think, or maybe January or February. I can't really remember. And then since he decided not to be admitted, so I asked him that, okay, I'll take care of you, but they're living actually in Samar. I mean Tacloban, no? So I'm just checking him time to time. I noticed that the values that the hospital there is quite different, no, than the one that we're using here in Cebu. But anyway, I just followed it accordingly, and he's still fine right now. I mean, he's fine now right now. So anyway, going back, platelet is one of the components that I've been checking, but it's not the main thing that we need to correct. Okay, later we'll discuss. If ever we have extra time, maybe I'll talk about wellness or even dengue to your class. No, I actually love talking more or giving lectures more about diseases than anatomy, but this is the subject offered to me. I was referred by one of my colleagues, so I just accept it, and that's the thing. Also nice to know, Ma'am Christine offered me to be, I mean offered a slot, or should I call it position? I'm not really sure. He asked me if I could, maybe that's the right term. He asked me if I could make a lecture, or I'll be the teacher or instructor or professor. I don't know how you address me accordingly, no, but for anatomy lab, but I somehow declined it for now, maybe because of the issues, no, or disappointment to a lot of things, and somehow like that. But anyway, let's just continue. So another white blood cell is composed of 5,000 to 10,000. It's actually 5,000 to 10,000. So if it's higher than that or lower than that, there could be a problem. I'll teach you how to interpret it later, and if we have time, and if ever I remember. Then the red blood cell is from 4.8 to 5.4 million. So it also differs for male and female. Usually females have lower because of, we're considering the menstruation and other stuff. Also children, for young individuals, they have different values, okay? Especially because they're still trying to develop even their system, especially the cardiovascular system. Also for the white blood cell, yeah, there is what we call the neutrophils. Just, I hope you can follow me. I cannot really place some pointer. We're on the third pinkish boxes, no? So the neutrophils, as you can see, it's 60 to 70%. Lymphocyte is around 20 to 25%. Monocytes is 3 to 8%, Eosinophils is 2 to 4, and Basophils is 0.1 to 1%. These 5 are the components of the white blood cell. Take note of the arrows. Anyway, I'll be talking about that later, about its functions and how we could somehow understand their purposes. I hope that's clear. You can actually take a screenshot, or maybe you can watch this again so that I'll have few other views. I hope that my page would reach to 1,000 man lang no nga subscriber, but unfortunately it's not that easy. Anyway, let's talk about the substances in the blood plasma. We actually mentioned this, but this is the more wordy part. For the water, which is 91.5%, it's actually the liquid component of the blood. Just focus on the constituent that I'm talking about. The function of the water is a solvent and a suspending medium. It absorbs, transports, and releases heat, as we mentioned before. That's why I always recommend I recommend to my patient, if ever that they have problems with sometimes headache, or maybe fever or so, please try to increase fluids, because it really helps. It helps a lot. If ever in regulation of temperature and even the electrolytes and other problems in our system. It's not the main medication that you want, but it will really help you. Okay, increasing the fluid. But there is what we call water toxicity. This is later I'll talk about that. There is what we call water toxicity. If there's an excessive water consumption, that electrolytes are like flashed away. Anyway, let's move on to the plasma protein, which is actually 7%, as we mentioned earlier, and there are a lot of components. But anyway, these are usually produced by the liver, or in Tagalog, atay. I don't know in Bisaya, I think it's also atay. It is responsible for colloid osmotic pressure, the major contribution of blood viscosity, as mentioned earlier. I think I didn't say that yet, and transports hormones like steroid, fatty acids, and calcium. Also, it helps regulates the blood pH. You may ask, what do you mean by osmotic pressure? It's actually the pressure of the, maybe I'll imagine. Let's imagine first. Unfortunately, I was not prepared to tell you this. When I was younger, I made an experiment. This is not literally an experiment. I just read something from our textbook, and then I tried to confirm if it's really true. This topic is for you to understand osmosis. This is not my topic supposedly, but this is somehow correlated with this plasma protein. I don't know if I can draw. I can't, no? Sige lang. I hope you bear with me, no? Let's imagine. Just imagine. I actually have the materials for this experiment are a jar, 2 jars, I think. I'm trying to recall my childhood memories. But anyway, a jar, 2 jars, then water, then a longanisa skin. I hope for our foreign students, no? Longanisa skin, I don't know how it's the longanisa. You ask your classmate what a longanisa is, or you check it online. The skin of the longanisa. O chorizo, longanisa na lang, because I'm not sure the difference between chorizo and longanisa. So, what I did was, first, I have the 2 jars, then I place both, I place the water on both jars, half lang, no? Half of the entire container. Then, I place a label A and B because I really follow instructions. No, usually when we make experiments, you should place labels. So for jar letter A, actually botilya siya, dili siya jar. But anyway, jar na lang para social. So for jar letter A, I placed anyway, let's go back. I prepared the longanisa skin. Longanisa skin, I tied, it's like an intestine, no? It's like, actually it's an intestine, but it's processed. So, I hope you know that. It's semi-permeable, meaning the water can actually transfer from one from the inside to the outside, but in time. No, but so anyway, I not the other side of the longanisa skin. Then I place water inside. So there's a content, there's a water inside. Then I tie it. Then I place a sinulid, no? Sabi ng Bisaya, sinulid. I use a thread, no, to let it hang. Then I place it on jar A. So sa jar A, and then I place salt. I forgot that one of the ingredients, or I mean the things that you need to have is a salt, rock salt to. I placed 2 tablespoons of salt on the water sa jar A. While on jar B, I did the same thing. So I placed the salt. It's only 1 tablespoon inside. Actually, hapit na mapuno. So, inside the longanisa skin with water as well. So, how do we imagine this? For jar A, the salt, both, it's like there's a floating longanisa with a water inside it, floating in a water with salt outside. While for longanisa B, there's a salt inside. I don't know if you have this experiment, but if you had, please, I hope you can imagine, no? I'm trying my best to explain myself. This is not part of the script. So anyway, so I just place it aside. After 24 hours, I noticed that the jar A, the longanisa, let's just say that the longanisa, no, it shrunk because the fluid, anyway, let's later let the interpretation. Then for jar B, it's correct bang grammar, it becomes more chubby. No, it's like that. So the explanation for that is because osmosis is the transfer. I am not really accurately sure regarding the definition, okay, but this is how I remember it. Is the transfer, or the movement of fluid, or the solvent. I'm quite confused. No, I remember it's solvent is like the tubig. No, that's why it's V. Then solute is the salt and other chemicals or minerals. So it's anyway. If I hope I'm correct because this is being recorded. But anyway, for osmosis is the transport of fluid or solvent from lower concentration to a higher concentration. Then or by like that. No, so meaning for jar A, the water molecule transferred from the inside the longanisa outside because there's a higher concentration of salt outside in the environment. That's why it shrunk. While versus jar B, that the fluid went inside the longanisa because of there's more salt inside the longanisa versus outside, so it become chubby, no, it's swollen like that, no. So what's the point? Other examples, no, for this, for you to really understand. It really took me some time to explain this experiment, but if whenever that you take you go to the beach, somehow you notice that your skin or your body, your entire body is quite dry. Also, you tend to be, most of the time you feel thirsty. Also, even if you take mga salty food, no, you become thirsty because water is somehow, especially for if you go to the beach, water goes out from your body, if you notice. But anyway, those are examples. This is how osmotic pressure is for just one simple word. I know you can search that, but it's best that we explain it here. So there are different proteins that actually influences the osmotic pressure. Albumin, which is the smallest and most numerous protein, as we mentioned earlier. The globulins, the large proteins, and also another fibrinogen is also a large protein. These are components of the blood. Globulins is one of the components of the blood. Fibrinogen is one important factor which is for the clotting. No, later we'll talk about that if ever. But I think I didn't place it here. So it plays essential role in the blood clotting as mentioned here. And then the immunoglobulins help attack the viruses and bacteria. That's the basic. Just don't mind the rest. because it's quite higher level na. Next, electrolytes, we have inorganic salts, which is the, when we say positively charged, it's cation, okay? Take note of that. When we say negatively charged, it's anion. So the most common is that for the cation is the sodium and potassium. We also have calcium and magnesium. Then for the anion, it's the chloride, the bicarbonate, sulfur, I think. I don't really know bicarbonate and stuff, but those are the components. No, I really remember this before, but now I really have problems reading this. But anyway, so these are the main component. Nice to know that I have things to share later about the piso, no? Potassium inside, sodium outside. Those are the mga techniques for you to remember about this. But I think we won't dwell too much about this because this is for the electrolytes. Maybe we'll talk about this during the GIT or other, maybe if it is part of that, okay? For the nutrients, it's very common, the amino acid, glucose, fatty acids, and so forth. No? For the gases, it's oxygen, carbon dioxide, nitrogen, as we mentioned earlier. You can please read the functions because I really had too much. I consume a lot of time explaining about osmosis. No, I don't want to explain everything one by one for now. Then the regulatory substances like enzymes, hormones, vitamins, same as the waste products. The urea, uric acid, creatinine, bilirubin, and ammonia. Nice to know because this is one of the common things or most common problems of my patients, just for you to understand, no? Usually, the uric acid, it's very... maybe I'll talk about creatinine na lang. The creatinine is actually one of the waste products of our muscles and metabolism. And remember, have you noticed that we usually, if ever that you have issues no sa body, we also ask you to check that for during your blood chem. Because usually, creatinine is excreted by our kidney. So, if there are problems with our kidney, usually, this creatinine level in our blood goes up. So, if for example, nagpa-check, you had a consultation, then serum creatinine was ordered for one of your workups, so and then it's elevated, meaning there could be an issue with your kidney. Nice to know. This is for us to know if the kidney is functioning well. Also, uric acid. Uric acid is also a waste product or metabolic waste of our muscles. Also, but meaning it's more on it's part of our system, no? We excrete the uric acid, but sometimes because of improper, maybe there's a higher level of absorption, as they claim there are food which are high in uric acid, but I tried reading some other journals, no, updating myself. There are some literatures that says that it's not really true that beans, mungo, and other vegetables could cause the increase of uric acid. I still need to confirm that because I'm very busy. I just read that, but I was not able. I was planning to confirm that, but I forgot. No, I need to read about that. If ever that you've seen journal or reliable sources, please send me a copy so that I can share it to my patients as well. No, because sometimes even if I'm planning to read something later, but because I'm quite busy, so I was not able to do that. But anyway, but I'm sure that uric acid is very high for red meat and for internal organs like liver or maybe isaw. I don't know I don't really eat isaw, no. Like the one with intestine for the foreign students, no. Usually Filipinos eat everything man good, even the internal organs. So it's very, very popular here. So those are those are products which are high in uric acid. So for example, normally you have uric acid being excreted by your system because of muscular metabolism, and still also you intake you eat this street food, and then you're old. So if you're old, your system cannot excrete them all. Unless for the young generations like you won't actually have any problems with this. But for old individuals like me, somehow we cannot excrete those normally, so it accumulates and causes crystallization of this uric acid. And usually these crystals are deposited somewhere like on joints, knees, on our foot. It causes extreme pain with a pain score of, usually based on my patients. And actually, I also had this condition, but as a doctor, we managed it early, so it didn't manifest anything. So for my patients, they usually rate the pain from 8 to 10. It's extreme, no? It's extremely painful. But for females, they rate it from 6 to 8 because they always correlate it with the the labor pains, no? So males are not so good with tolerance, no, because gamay ra nga pain kay mo ing dahil. But anyway, let's not talk about the patients. So if ever you have problems with uric acid, you can actually have consultations, or we can actually talk about it for you to avoid future problems like crystallization of this, so that it won't manifest. No, it's always best to have prevention than cure. Remember that, especially because I'm into family medicine, so prevention is always our work. Anyway, in front of you is a smear. No, actually, it's a blood cell smear. So it's times 400. The one, you can see the labels, no, the purplish, the one with different, the dark colored cell, it's actually the white blood cell. Specifically, it's a neutrophil. Then the other one, the upper right corner, I was referring to that, no? Then the other one, the one labeled below, it's actually a white blood cell. Specifically, it's a monocyte. Medtechs are better with this because they studied about this, they focus about this. So those donut shape with a pale center, those are the red blood cell or red blood cells. Then the clear one is the plasma. So those small tiny little cells, those are the platelets. It's actually labeled, so we don't have any issues with understanding or identifying. So now in front of you is actually the production of different blood components. So I know you'll be searching about this. I know some of you are even watching other videos for you to understand, but the only thing that I want you to remember is actually the differentiation. So remember when I talk about the stem cells before, after the sperm cell and the egg cell meet, and then they they multiply. Initially, they are stem cells, then they are assigned to different organs or systems, then they differentiate. Okay, so let's focus. For the first one, for example, let's start now here. The stem cell for the entire components, no, for the different components of the blood, it's what we call the pluripotent stem cell. So it could divide into two components or subdivision, or maybe we could say it could differentiate into two components. It could be a myeloid stem cell and it could be a lymphoid stem cell. They're different family. So let's talk first about the lymphoid stem cell because it's quite easier and better to remember. So the first one, the lymphoid, once the pluripotent stem cell becomes the lymphoid stem cell, or it multiplies it differentiates into a lymphoid stem cell, it could also be classified, or it could differentiate into a T lymphoblast, a B lymphoblast, or an NK lymphoblast. And once they mature, the T lymphoblast becomes the T cells or the T lymphocyte. These are important for the killing of microorganisms. But anyway, also the B lymphoblast becomes the B lymphocyte. So if it's still a blast, it's still not mature. Then this B lymphocyte or B cells could become the plasma cells later as it travels somewhere, no? We mentioned about this before. But anyway, the NK lymphoblast becomes the natural killer cells. This is one of the these three is together with the monocytes. These are the agranular leukocytes. well, you may ask why it's called like that. I cannot answer you for now because it may take some time for me to explain one by one, and I need a better picture for you to know why they are a granular leukocyte, but they don't have granules, period. That's a thing. So they just take note of that. Okay, you just memorize this diagram. Okay, so I hope that's clear for the family of the wait lang ha, I'll just click the button again if I'm okay. I shouldn't click that, so I'll just go back. So that's for the lymphoid stem cells. Now let's focus our attention to the left part, which is the myeloid stem cells. It could be classified into different families as well, subfamilies, by the CFUE, CFU-MEG, the CFU-GM. It means the colony forming unit or erythrocyte, then colony forming unit megakaryocyte, then the colony forming unit granulocyte and macrophage. So for the progenitor, these are the progenitor cells as labeled, no? The color green are the progenitor cells. Then these progenitor cells becomes let's focus first on the CFUE for the erythrocyte, meaning for the red blood cells. So the progenitor cell is the CFUE, then it becomes the precursor cell or the blast cell, which I mentioned it's not mature yet, will be the pro-erythroblast. Bisaya kayo, no? Pro-erythroblast. So for the pro-erythroblast, it still contains a nucleus. So once the nucleus is ejected, that's why there's a pale color inside in the middle, no? But anyway, it's important later. If we're going to focus the discussion about the red blood cell, maybe you'll know why they need to eject that. Anyway, once the nucleus is ejected, it's called the reticulocyte. So I'll just go down, and then it becomes the red blood cell or the erythrocyte. So just recall, CFUE becomes the pro-erythroblast, but since it's blast, it still have a nucleus. Then it ejects its nucleus. That's why it's now called whenever that the red blood cell ejects its nucleus, it becomes the reticulocyte. Then as time goes, no, it becomes the matured cell, which is the red blood cell or the erythrocyte. So that's the mature one. Now let's go to the CFU-MEG. When we say MEG, it's megakaryocyte. That's for the platelets, no? So it becomes the megakaryoblast. So blast, it's for the not so mature. Then becomes the megakaryocyte. It's still big. Then it's a big cell. It divides into different components, which is what we call the thrombocytes, or the aka the platelets. Now, they are important for clotting. Okay, I hope that's clear. That's how they mature, or their life cycle, should I say. So now also one of the component of the let's focus on the CFU-GM, or the granulocytes and macrophages. It could be differentiated to different the cell could be differentiated into eosinophilic myoloblast, basophilic myoloblast, or the myoloblast per se, monoblast. For this, they can become a mature, like for example, the eosinophilic, it becomes the eosinophils, then basophils for the basophilic, neutrophils for the myeloblast, and monocyte for the monoblast. This monocyte, as it travels, remember we talk about macrophages, especially sa cells or muscle, sa component of the skins, no? And then also nice to know that the muscle originally came directly from the myeloid stem cells. So what should I share about this? There are ways to remember this, but I'll talk about this soon if there's enough time, because we actually had consumed too much of the time. Nice to know the three component, which is the eosinophil, the basophil, and the neutrophils, are the granular leukocytes. Leukocytes. For me to remember before, I just imagine a person named Ben, or Ben, no, the Ben, and Ben has a lot of pimples, so that's why they are granular leukocytes. That's my way of remembering. For the other ones, just if ever it's not mentioned, obviously it's not. It's as long as it's part of the the WBC, and it's not part of the Ben or BEN. So meaning it's a granulocyte. So just don't choose red blood cell or maybe platelets, okay? If ever I make your quiz like that, okay? I hope that's clear. So if you have questions, just ask me later. I know it's quite complicated, but you just memorize it. Just don't dig deeper about the explanations, because I know there's a lot of things that we need to learn about this. We just don't have enough time. Okay, for now, at least we know the basic. So nice to know. Do you red blood cell? This is the life cycle of a red blood cell. They usually have around 120 days average lifespan. So they stay in our system unless if you have problems, like for example, you are in chemotherapy, or maybe you are taking drugs and medications that could cause the early death of the cell, or maybe you have genetic disorders which could actually lead to make the red cells survive exceeding 120 days, but normally it's only 120 days. Okay, so now you can see that there are labels 1, 2, 3, 4, 5, 6 until I think it's around 13 or 14. So follow me. I'll just mention the number so that you know we're referring the story is starting or so. No, but anyway, after a while, after 120 days, just start on the topmost part. As the blood circulates all over the body for around 120 days, it is actually it goes to the spleen, the liver, or red bone marrow, where it is being phagocytized by macrophages, and the worn out red blood cells are actually stored there. The globin, it divides into two. It could be this is, we're referring to the red blood cells, okay, as it breaks down or it ruptures. It becomes the component of the red blood cell are divided as well. The globin and the heme, because remember hemoglobin, that's the thing. So those are the components. For the globin and the heme portion are actually, as I mentioned, no, they have different pathways. They split apart. That's for number 2. Number 3, focus on the number 3. The globin component, or the part of the red blood cell, is broken down into amino acids, or which can be reused later or synthesized as other protein. It actually for the system, no, we just do our work, and it's up to you if you want to make these amino acids into something else, like part of the other cycles, or if you want to make another red blood cell. So but it could be used that way. Now let's focus on number 4. I hope you can locate the number 4, no, sa heme part. The iron is in this component, the heme. The iron is removed from the heme in the form of Fe3. As you see, they are Fe3, which associates with the plasma protein ferritin, which is a transporter for Fe3 in the bloodstream. This is important. They place a gray thing here. Actually, these are the components that we check if ever a person is suspected to have anemia or to have problems with the red blood cell. Later, you learn this as you go to the pathophysiology, or to the medical part of the anatomy. Actually, I'm not supposed to tell you something about this. I'm not really banned to share about this, but supposedly I'm supposed to share about the basic ones. But it's always more nice if we go advanced, no, or advantage for you, no, so that soon you'll have better knowledge about the topics that they'll be discussing. So where am I? So the transferrin, again, the transferrin carries the, am I in that part? So if, for example, I just recall, okay, for it to be very clear, because I know this is very, it was described in a long manner, I think, by other textbook. So once the red blood cell lies, because of it's around 120 days na, it divides into a globin component and a heme component. For the globin component, it becomes amino acid, then it could be recycled or reused to become another red blood cell, or to a different component or cells, or it could be part of the muscle cells. Now for the heme component, the iron component of the heme becomes Fe3, and it is carried by the transferrin towards the, because remember when I told you earlier that transferrin is a transporter for Fe3 in the bloodstream. So it's being carried by the transferrin towards the liver. So now in the muscle fibers, liver cells, as I mentioned, no, one of those things, it could also go there. And the macrophages also of the spleen and the liver, it could also, the Fe3 could also be transported there. Then the Fe3 detaches from the transferrin and attach it to an iron storage protein called ferritin. That's the one on the gray area. So again, heme, the iron component, becomes Fe3. Then it is being carried by the blood. This is the what we call now the transferrin is the transporter of Fe3 or the iron in the bloodstream. So it carries the Fe3 to different parts of the body. Like for example, I know I keep on repeating this for you to really understand, because it's difficult to just show you the picture. Okay, so the transferrin carries the Fe3 to the different organs. It could be in the different, it could organs or other component. It could be the muscle fibers. It could be brought to the liver cells. It could also be in the macrophages of the spleen, also the liver or so. Okay, then the iron detaches from the transferrin because sundo raman siya. It's only the let's imagine it's only a taxi. Now it cannot go inside the mall. The mall is the liver. So now the iron is then carried by the what we call ferritin, which is I hope I'm waiting for your answer now, but anyway, it's the iron storage protein in the liver. So it's being stored. Okay, that's why if ever I have patients with iron deficiency anemia, usually other than, for example, it's not that severe yet, I don't really recommend, especially for those people or patients na medyo financially challenged. I recommend na you can have liver na lang. You can eat the liver of a pork, or maybe you can eat the liver of the chicken. You can buy that. I think it's more economical, and it will. Okay, sometimes I know I'm not really sure with the prices, but as soon as you become doctors, consider those, because it's not everybody who could afford. I know it's true. Ferrous sulfate is not that expensive, but imagine for those who are, maybe for us it's expensive. For those na isang kahig isang tuka, how do you call that in English? For those, basta poor. For the poor people, even 5 pesos is very big. Ako, whenever I'm not saying I'm rich, but anyway, whenever I'm very busy and I drop 1 piso or so, sometimes I just pasag din lang na siya. It will take some time, no? And remember, if you're busy, sige na lang, I'll just donate that to anyone who are interested. So for them, it's a very big amount, 5 pesos maybe. No, that's what I noticed. So prescribing another medication will be too much for other people, especially for the poor. Why not give them a way that the patient is having iron supplement, to correct the iron deficiency anemia, while having the proper enough budgeting, because their budget might be for food alone. So why not choose a way that you can use the food as the supplement? But if the iron deficiency anemia is severe, you really need to correct that. You may even decide to admit the patient. Anyway, I'm just giving you ways on how to manage your patients in the future. Maybe 8 years from now, or I don't know, when would you start med school? For my case, I didn't instantly go to med school because I rested for a while. So that's why it took me some time. Okay, it's always best that you will prepare yourself. Anyway, too much about me. Let's move on to that. That's for number 6 now. Okay, let's move on to number 7. So now the the iron, no, with the transferrin. Sorry. The iron is released. So again, if for example, remember that the ferritin is for storing alone, the proteins for storing iron. Now, if there comes a time that you are needing an iron component for the creation of red blood cell, once again, the iron is being fetched by the transferrin, because remember, our taxi is the transferrin. So the taxi driver will carry the iron again to its destination, which is the bone marrow. I hope you remember our topic or our discussion about the production of red blood cells, another cell component. Usually it happens in the bone marrow. So as we mentioned earlier, the Fe3 transferrin component or complex is then carried to the bone marrow, where the RBC precursor cells that we mentioned earlier take it up through the receptor-mediated endocytosis. So it's being absorbed, no, for the use of the synthesis of the hemoglobin, and specifically for the hemoglobin. Then the iron is needed for, as we mentioned earlier, can you recall that for during the past, no, in this part, the iron came from the heme, not the globin. Okay, I want to emphasize that. So it came from the heme. Now, in this process, the iron is needed for the heme portion of the hemoglobin molecule, and amino acids are again used or needed for the globin portion. So those are the component. But as you can see, no, they mix the iron, the globin, together with the vitamin B12. I hope you can see the one below. Okay, as you see, I hope you can see that. So vitamin B12 is also needed for the synthesis of the hemoglobin. Then that's the time that erythropoiesis is in the red bone marrow results in the production of the red blood cell, which enters the circulation later as it matures. So now we're on we're number 8 na to, ha, when I'm talking about the number 8. I hope that's clear. So we already created a new red blood cell. Then the red blood cell will again travel to the circulation for about 120 days. And I placed the wrong button again. As it travels to the 120 days, it's again a cycle. Here, it goes to the number 1, the number 2, and so on and so forth. But let's discuss about the other component. Now, remember, I hope everything is clear. We're done now. I hope it's clear, no? So now let's focus on number 9. So the heme component separates into iron and biliverdin. So just for number 9, okay? When the iron is removed from the heme, the non-iron portion of the heme is converted into biliverdin. It is actually a green pigment. Now, when you say pigment, it's colored. And then into bilirubin. I hope you're familiar with that. Which is the bilirubin is a yellow-orange pigment. Okay, I hope that's clear. So again, for biliverdin, the green one, before the number 9, it is actually the first part, no? So again, just to make sure it's clear, heme will be the heme, no? Hemoglobin. let's go. Should I go back? No. So let's just focus here on number in heme. Heme, the iron component is removed from the heme. Then the non-iron component, which is converted into biliverdin. Verdin, for Spanish, verde. No? I think it's Spanish. So verde, it's green. Then into bilirubin, which is yellow-orange in color. Okay? Then, let's go to the number 10. As you see, it travels to the liver again. Then bilirubin enters the blood and is transported to the liver, as I mentioned earlier. And then within the liver, the bilirubin is released by the liver, by the organ cells into bile. I know I didn't share it yet, but anyway, it released into bile, which passes into the small intestine and then into the large intestine. And then, as you see, there's the transfer, no? Where focus yourself on number 12. In the large intestine, the bacteria converts bilirubin into urobilirubin, and then some urobilirubin is absorbed back into the blood and then converted into yellow pigment again called it's now urobilin, and then excreted via urine. I hope that's clear. That's why the color of our urine is yellow. Okay? So again, so that this would be clear, because I know you heard a lot of bin and urobilirubin or so. So when the iron is removed from the heme, then the non-iron, which is actually what it's not yet termed, no, it becomes or converted into biliverdin, which is a green pigment, then into a bilirubin, which is a yellow-orange pigment. Then the bilirubin enters the blood and then transferred to the liver, and then within the liver, the bilirubin is released by the liver cells into bile. I don't know if I shared this to you before. Anyway, let's pause for a while now. This is a commercial. I don't know if I shared that the bile salts are actually not created by the gallbladder. It's only stored and being concentrated in the gallbladder. Okay? Because it's the liver who makes the bile. Okay? So anyway, that's a process that they skipped in this part. No, they didn't focus on the gallbladder part. Okay? So where am I? So we're the patient. We're talking about the bilirubin, no? So in the large intestine again, the bacteria converts the bilirubin into a urobilinogen. Then some of the urobilinogen is absorbed back into the blood, which converted into a yellow pigment called urobilin, as you see, which is actually excreted in the urine. Then most of the urobilinogen is actually eliminated in the feces in the form of the brown pigment called stercobilin. I hope you can see that, the brown pigment. It's called that gives the color of our feces, no, to be brown and golden. So that's a color. So then it goes out. That's the process, the excretion part. Now, I hope you understand most of the things. Just play this again. I know it's quite complicated, or maybe some of you, I repeated it several times, so I hope it's clear. Okay? So if you have questions, please tell me. Please ask me so that everybody will learn, okay? Honestly, I feel sad whenever that you have low scores or whenever that you don't understand my lecture. I really tried my best to make it as easy as possible. For the quiz, sometimes no. But anyway, for the lecture, I want you to understand it clearly so that you can use it as you practice in the future, because I think my lecture is one of the foundations, no, for you to become good doctors in the future. So that's what I'm doing. No? Anyway, now we already consume a lot of the time. See, this part pa lang. So these are the different, that's for the red blood cells. Now this is for the white blood cells. I told you earlier that the white blood cells are actually divided into, subclassified into different components, which is the neutrophils, the lymphocytes, the monocytes, the eosinophils, and the basophils. So this is the part when you need to remember this for your future. I know it might be not your work, no, but I'll give you an idea on how to interpret your complete blood count. But please don't diagnose, you're still not licensed to do such. And if ever that you have, for example, you have a relatives, who gave you the CBC result, please don't tell them na lang right away about your diagnosis. Labi na if they think that you're very smart, or if they believe you, because you might be they might be deceived by the information, because there are levels that you need to know. Okay, and we need to correlate it. You need to be trained. Okay, we cannot be instant doctors. Okay, so anyway, so how I remember this is the first, the mnemonics, NLMEB. So what I remember is never let monkey eat bananas. Again, for the mnemonics, never let monkey eat bananas. I don't know why, but anyway, so that's how we remember. Usually, neutrophils are the first one to arrive in the site if there's an inflammation, if there's an infection, and so on and so forth. Also, if it's a bacterial infection, usually it's always neutrophils. Okay, so anyway, let's talk about it. No, that's why N for never. That's the order. That's the first. Neutrophils are the first. That's another topic, it's more on for the med school or med tech part. But let's talk about the highs and lows. Whenever that the neutrophils is the neutrophil count is significantly high, it indicates that there could be a bacterial infection. It could also be high during burns, during stress, and during inflammation. Nice to know. Whenever that the patient had a vomiting episode, for example, it's a child, or maybe let's just talk about an adult, an adult or your grandfather had a vomiting episode, if he vomits. Sometimes when we consider when we want to know if there's an underlying infection, we want him to undergo CBC, another test. Unfortunately, I usually advise my patient, if ever I might ask you to wait for at least 4 hours, or maybe can come back after 4 hours for actually it's 4 to 6 hours for me to have a sample of your blood, because vomiting is a process of inflammation. It's not really an inflammation, but there is an inflammatory process once we vomit, because of the reaction of the pressure and the blood cells. It's very long explanation, and basta mao lang to, just stick to that, vomiting. So we wait for at least 4 to 6 hours for us before we extract blood, because normally if the patient had vomited few hours ago, there is a chance that the neutrophils would be elevated. So there's no point. It's like useless na we took the blood. We just prick the patient without the use of pointless pricking the patient. Okay. Anyway, if there is a low count of the neutrophils, it could be because of the radiation exposure or therapy. It could be because of drug toxicity. It could be also because of the vitamin B12 deficiency. For a disease, systemic, that's the SLE, the systemic lupus erythematosus. It's actually a disease, an autoimmune disease. So when we say autoimmune disease, it's like, how do I imagine this? It's like your own system or your own immune system is killing yourself. Whenever, I don't know, I just imagine, I just want to share what I imagine. I know for others, this is very irrelevant topics, but let's not focus too much now, okay? It's very stressful if we always talk about this. Commercials, ah. So, whenever I iron my clothes, though, usahay ra na siya. And I pass through, I ran over the cords of the plancha of the ironing device. I really forgot the flat iron. So if whenever I run over that, plancha na ko siya ba, I always imagine, this is an autoimmune disease because you hurt yourself, Mr. Plancha. Or maybe what else pa ba? It's like supposedly your immune system is supposed to kill. Sige, let's talk about COVID-19. Usually COVID-19 in some point, no, based on the common studies, though they are not really concrete pa with the information that they really share, but based on my readings, somehow it's somehow an autoimmune disease. Not literally an autoimmune disease, because autoimmune disease should have no any bacterial infection or so, but it's like your immune system will create more trouble, thus it will make your condition worse. Because it's only, they thought that all the cells of your lungs, or most of the cells of your lungs, are part of the bacteria, so the immune system tries to kill it. That's why some doctors recommend to give the patient an it's like steroid-based medication to treat the patient, no? But those are actually experimental yet, because there's a lot of controversies, no, or a lot of studies that we need to do before we conclude to a specific na management. There's a lot of diseases before, no? I don't know, I watched a movie, I think it was a Japanese movie, the Wind Will Blow. I really forgot. It's an anime. I don't know. It's, for me, anime and cartoons are the same, but basta cartoons nga Japanese, it's anime. That's what my sister said, because I'm confused. But anyway, I saw na the mother of that specific character died because of tuberculosis. So before, there was no treatment for TB or pulmonary tuberculosis, but right now it's like a normal thing. I just hope that this also happens, or it's also the thing about COVID-19. I hope that this will be gone soon. I thought it only will last for 1 year, but it's more than that. No, but anyway, let's hope that vaccines are effective and it will be available in the market soon. We're too much for the commercial. Let's go back. So it's very clear, no? Neutrophils, if high, bacterial, usually. Then if it's low, there are a lot of factors. It could be also autoimmune disease, just like SLE. Now let's move to the next one, lymphocytes. For the lymphocytes, whenever that there's an elevated level of lymphocytes, it could be a viral infection, and for also true for leukemias. But you cannot diagnose your patient dayon, ha? If ever you're for those who are I think in the future, no, you become you moonlight or so, na you're like a doctor. You're a passer, but you need to earn more money. You don't want to go training or residency yet. So some doctors are actually lost with their diagnoses. So I just explain things but you're not allowed to say something bad to your colleague, okay? So just say na maybe your first doctor had some errors because of this and that. Maybe he was not able to notice this or not correlate. So you defend your co-doctors, okay? So this is, you cannot diagnose your patient right away that, mom, you have leukemia because you have somehow elevated lymphocytes. No, you cannot say that. Have further workups and correlate it with the symptoms that the patient is experiencing. Okay, so most commonly we diagnose the patient with elevated lymphocyte to have viral infection. So for never, for letter N, it's bacterial. For lymphocyte, it's viral. And then for low counts, usually there is a prolonged illness. If the patient is immunosuppressed, if for treatment with cortisol or steroid-based products. So usually this lymphocyte will go down. Okay? The next one, monocyte. If there's an elevated count, it indicates that there is a viral or fungal infection. No, so either viral or fungal infection. It could also be elevated for patient with tuberculosis. And for for those who have leukemias and chronic diseases. But if it's low, bone marrow suppression for treatment like cortisol again, because this is one of the reasons why I always advise the people who asked me, especially for those who are athletics, if it's okay for them to have steroid na mga supplement. I always tell them na maybe it depends on you, but I am not really into giving steroid supplements or even other supplements which are not really necessary, because steroid medication could shrink their balls, no? Ilang itlog mo gamay. Because remember, steroid baya. Sorry for the foreign students. Now, steroid is actually a medication for it's actually a component of the female hormones, diba? Steroid, like estrogen, no? From the word, it sounds like esteroid, estrogen, no? So it's a component. So if you are taking or injecting this, so it could end up to the mo shrink imong balls, and it could also somehow some patient will say na they become chubby. Obviously, yes, because I think I already discussed this before, no? I think I shouldn't discuss too much on that because basin unya mahurot atong time for this. Anyway, that's the thing. And also, in correlation with this, the immune system will go down because of these blood components will be affected because of prolonged use of steroid-based medications or supplements. The lymphocytes and monocytes, which are important for defeating microorganisms, specifically for viral and fungal infection. So, maubos ni siya, there's a higher chance of you having other diseases or having viral infections. So, avoid if possible. But if your bread and butter is for athletes, no, for those who are really, you're earning millions because you're an artista with big muscles, so it's really up to you. So anyway, maybe it's up to you, no? Ako, unfortunately, I don't have that. But let's move on. Next one is eosinophils. So if it's elevated, it indicates an allergic reaction, and then parasitic infection as well, and autoimmune disease. Maybe I just want you to remember that it could be because of allergic reaction and parasitic infection. But for quizzes, you can just memorize autoimmune disease sooner. The reason why I told you that my way is saying that you should memorize it by heart. It's allergic reaction and parasitic infection because usually that's the most common ones. I know you can memorize the autoimmune disease, no? But soon as you memorize a lot of things, if you cannot secure these two, the allergic and the parasitic, no, you'll forget everything. you'll remember now. Eosinophils, I forgot. Is it about bacteria or viral? No, it's like that. Yeah. So for allergies and parasitic infection, eosinophils. Okay. I have my own ways of remembering, but it's green like eosinophils. But later na, I won't correlate that for now because it's very green. So now, for low count naman, it indicates drug toxicity or maybe stress. Okay? And then, finally, ipiyok pa ko, no? Finally, basophils. If there's an elevated basophils, it indicates that there could be an allergic reaction for, yes, really, kani siya elevated for leukemias, cancers, and hypothyroidism. Then if it's low, it could be because of pregnancy, ovulation, stress, and hyperthyroidism. So, basta hypo, it's if it's basophils, if hypo, it's high. Hyper, it's low. It's contrary, no? So, what should I tell you about this? See, it's commercial. There are some patients na I asked, usually, especially for my clinics, I have online clinics, as I told you. I always tell them that, Mom, I want you to undergo CBC for me to know if you have infection and for me to know if it's bacterial, if it's viral, or if it's only an allergic reaction or something else. So they always tell me, Doc, I had my CBC 2 weeks ago. Can I just use this instead? And that's the explanation. No? Time to time, it could change, even just overnight. Everything could change. These parameters will change depending on the infection, or maybe because yesterday you don't have any infection, then right now, there is, though dili na siya mo change tayo, no? That's why I usually ask my patient to, for example, you had fever right now, I'll tell you that I cannot really send you for a CBC yet because most of it will be normal. But after 3 to 4 days, there could be changes, and that's the time that I want blood to be extracted from you. But it's a different case for dengue cases, no? For dengue fever, because we usually want to check the hemoglobin, the hematocrit, and the platelet level of the patient every day. So that's a thing. Now let's move on to that. I'm supposed to click that while I was talking so that it will be focused, but I forgot to click that. So now let's move on. Let's talk about just a recall and about the different components, including the all the components of the blood. No, let's talk about first. No, the effects is not good. The red blood cell, or what we call the erythrocyte. It's actually 4.8 million per microliter in females, and this is for average. I think it's 5.4 million microliters per microliter in females. In males. The character is it's around 7 to 8 micrometer in diameter by concave disc and without nuclei. Remember when there's an ejection, right? So it is around the lifespan. I call it lifespan, but they term it as it lives for about 120 days. The function of the red blood cell, or RBC, is for the hemoglobin within the RBC transport specifically they refer it as they want you to know that it's the hemoglobin within the RBC transport most of the oxygen and part of the carbon dioxide in blood, as we mentioned earlier. Now, let's move on to the white blood cell. For the white blood cell, or WBC, or also known as leukocyte, it's the normal value, no, or the range is actually from 5,000 to 10,000 per microliter. The characteristic is anyway, that's not important. It combats, for the function na lang, the lifespan is only 4 hours or few days. It really depends, no? Anyway, for the function, it combats pathogens and other foreign substances that enters the body, or enter the body. And let's talk about, that's for the WBC or leukocytes. For the granulocytes, with the granules, as I mentioned earlier, which is BEN. Mnemonics na to, no? It's Ben, with pimples on the face, a lot of granules. So for the neutrophils, it's 60 to 70% of all the WBC. The characteristic is it's around 10 to 12 micrometer in diameter. The nucleus has 2 to 5 lobes. This is one of the things that they usually ask for medtechs, no, regarding lobes. Connected by the thin strands of chromatin. The cytoplasm has very fine, pale, lilac granules. So it's just the granules. Just remember the granules. I'm not even sure what a lilac or lilac is. So just the granules. That's why it's called granulocytes. No, I don't know everything, okay? Just so you know. So this is for the medtech part. The function of the neutrophils is for phagocytosis. We always talk about that, no? Engulfment of microorganism, phagocytes. That's a term. It for destruction of bacteria with lysozymes, defensins, and strong exudants. Such as superoxide anion, the hydrogen peroxide, and hypochlorite ions, or that's anions. Those are for the types of bacteria. For the eosinophils, it's 2 to 4% of all the WBC. Remember this. This is important. But just remember this. The characteristic is 10 to 12 micrometer. That's for the diameter. Nucleus is usually 2 lobes and connected by thick strand of chromatin. As you see, try to check the picture. Now, for the neutrophils, there is 2 to 5 lobes. It's also connected. The 1, 2, in this picture lang, no? For example, let's imagine that there is a microscope. 1, 2, 3, 4. There are 4 nucleus. Well, for for the Eosinophils, if ever that, I don't know why would you check the microscope if you're a biologist. My biologists usually check everything, right? So for nursing students, we don't usually check the microscope. We let the medtech do their work. But anyway, for this part, if you become doctors in the future, as you check the microscope, there are two lobes. So you can actually also think of use neutrophils because it's 2 to 5. But since it's connected, no, the two lobes connected by thick strand of chromatin, and usually there is a large orange granules that fill the cytoplasm. So if there's orange granules, that's a eosinophils. Okay? So orange. I don't know why would we memorize this, but memorize this for quiz purposes. But I know you'll forget about that soon. Anyway, the function of the eosinophils is to combat the effects of histamine in allergic reaction. Because remember, as you go back later now, as you flashback, remember what we talk about this. If there is an elevated eosinophils, meaning there is for neutrophils first, for bacteria, right? Or for inflammation. So it's actually placed on you can see it in a function. But for eosinophils, it's for viral, or it could be for, allergic reaction or parasitic infection. Okay? So that's why it grows, or they elevate in number if there's such infection, because they combat effects of histamine in allergic reaction, phagocytize it engulfs the antigen and the antigen antibody complexes and destroy the certain parasitic worms. So that's why they're elevated. Okay? Then the last granular leukocyte, it's the basophils, which is around 0.5 to 1% of all the WBC. It's quite smaller than the two. It's around 8 to 10 micrometer in diameter, and the nucleus has two lobes. Largely cytoplasmic granules appears deep blue purple. So I don't know if for quiz or maybe for your personal need or personal knowledge, if ever it's orange or eosinophil, there's an O. For neutrophils, I think it's very fine lilac. I really don't know what a lilac, no. I think that's a color granules. Forgive me, I really am not sure about colors. I even consider myself to be colorblind, but no, it's not really true. I just don't know how to identify specific colors. But anyway, going back, for the blue, it's blue for basophil. So it's easy to remember the first letter. And remember the BAN or Ben, these are the granular leukocytes. We're having a review, no? We're not done yet for the basophils. So for the function, it liberates the heparin and histamine and serotonin in allergic reaction that intensifies the overall inflammatory response. Now let's move on to the granulocytes. Granular leukocytes. So for the first one, it's the lymphocytes, which are the three. Remember, we talked about the lymphocytes earlier. It could be the T cells, B cells, or the NK cells. The size of the percent is around 20 to 25% of all the WBC. And usually, remember the purpose, it's for viral infection, right? Remember that. So their characteristic is it's small. The small lymphocytes are 6 to 9 micrometer in diameter. Large lymphocytes are around 10 to 14 micrometer in diameter. Nucleus is round or slightly indented. Cytoplasm forms the rim around. So there's a rim around the nucleus that looks like blue. And then the larger the cell, the more cytoplasm is visible. So that's the thing that you need to consider, because there are three cells, no? T cells, B cells, and NK cells, so they differ time to time. So anyway, the function is it mediates the immune response, including the antigen-antibody reaction. The B cells develop into the plasma cells, as we mentioned earlier. Remember that the diagram, which secretes antibodies. So Take note of this. We'll also talk about antibodies later. So it's from the B cells. Antibodies. There's a lot of things that we need to remember, no? But anyway, you'll know that. You're smart anyway. So anyway, the T cells attack the invading virus or viri or viruses. They use it. Cancer cells and transplanted tissue. So for some patients who have what we call transplants, no, heart transplant or so, we usually give steroid-based medication because these are one of the, remember earlier, if you take cortisol-based drugs or steroid-based drugs, there is a decrease in level of lymphocytes and another component, no, another part of the white blood cell, because T cells specifically, which is a part of the lymphocytes, is the one that we need to be weakened so that there's no rejection of the or death of the donated organ from another person or cadaver. I think it's a person, no? So it's like that. So that's a thing. Also, the NK cells attack wide variety of infections, microbes, and certain spontaneously arising tumor cells for patients who have cancers or so. Also, that's what these are actually. I mean, not cancer yet, no, for tumor cells. Maybe if ever it's resolved, so it won't go to that way or manner, no. Anyway, let's move on to the monocyte. The monocyte is around 3 to 8% of all the WBCs. It's quite big, a little bit bigger, no. Actually, it's the same size as the ones, right? Yeah, it's quite bigger. It's from 12 to 20 micrometer in diameter. The nucleus, yeah, obviously from the picture, no, as I noticed, it's the biggest, I think. The nucleus is kidney or horseshoe shape. So if I mention it's kidney shaped nucleus or horseshoe shaped nucleus, that's for the monocyte. So the cytoplasm is blue-gray and appears foamy. So the purpose or the function of this is it engulfs, no, the microorganism. After that, what they placed in, it's wandering. It becomes macrophages or so. So that's a thing for the agranular leukocytes. Okay, I hope that's clear. So for agranular, there's only two that you need to remember. ALM, no, it's L and M, but there are 3 lymphocytes, so it's T cells, B cells, and NK cells. So that's a thing. Now don't answer platelet or RBC, ha, if ever nga enumerate yun. But anyway, so for platelets or the thrombocytes, it's around 150,000 sorry, or 400,000 per microliter. We also mentioned this earlier, so I hope you can remember that. The size is around 2 to 4 micrometer in diameter, and these are actually fragments of cells. Remember earlier the megakaryocyte, no? It lives for around 5 to 9 days and contains many vesicles but no nucleus. So the function of this component of the blood is it forms the platelet plug in hemostasis. Nice to know how to understand. Hemo is blood, stasis is stop, no? Stopping or so, blood clotting. Stasis or basta ka na, stop. And also, it releases chemicals that promotes vascular spasm and blood clotting. So I hope those are clear, and I know you really know what a platelet is. So now, I think I'll just stop here, even if we hadn't even reached the 50% of the discussion. No, I will still ask you soon. Please message me again if ever that you want to have the ECG lecture, because I am not even sure if I could finish this lecture for just 1 or 2 sessions. No, but because this is a very long topic. During our lectures, I even share a lot of stories. Unfortunately, no, to make sure that you can correlate. That's why I share stories. And so that it won't be as boring as it is. No, that's why I share stories. Anyway, sige na lang, good. So, for now, This is for the blood typing. Nice to know lang. Another story from me. Before, I thought I was blood type O for a long time, since uh, elementary until college, no? I thought I was type O. But when I went to Red Cross and volunteered to help them in like screening the people in St. Louis University before in Baguio City, no, screening for individuals who who wanted to donate blood. I tried checking my own blood type, and when I checked it, it's like this. This one. You prick yourself. Actually, let's just imagine I'm the doctor and then you're the patient, no? I will prick you. The first thing is I need to use the capillary tube to check to extract, no, so that I don't know the specific terms, my good, of the equipments. Then you drop two bloods, two drop, no, two drop. The one is the one aligned with the anti-A serum, and then B. Then you place those solution. If it clots, if the anti-A serum, if the blood clots after placing that, meaning there's an A. Then if there's another clot, there's another letter, so it's AB. But if, for example, it's only anti-A serum that clots, it means it's your blood type A. But then if it's B only, so the first, as let's just check it accordingly, no, let's follow the line, follow the I'm citing examples, my good. Let's organize my thought. So if we place the solution whichever the, if for example, if muklat siya, it means that that's your blood type. So if it's A, it's blood type A. If it's B, your blood type B. If both of them nagclot, no, it's your blood type AB. But if none of them clotted, no, if it's walay clot ngayon, it's can you see the clot? I hope you can see that. So meaning your blood type O. Okay, I hope that's clear. Bisan, I know my explanation was quite lost. Sorry, I'm quite sleepy na. I'm very, very sorry. It's not an excuse, but say lang, I really woke up early for this. Anyway, where am I? Here. Why is that? What's with the clotting, no? Remember that our red blood cell represents, maybe in their area, maybe in their surface area of the red blood cell, or in the outside part of the red blood cell, they expose what we call antigen. Okay, the red blood cell could have antigen A if you're blood type A, antigen B if you're blood type B, but if you're blood type AB, you will have antigen A and B. While if you're blood type O, neither A nor B. So meaning you don't have antigen. You'll know the reason why, what's the importance of antigen, maybe. I'll try my best. So now, in our plasma, if for example, you are type A, your plasma has an anti-B antibody. So these are part of the plasma, which are the active ones, no? Antibody. They don't like, since the blood type, I'll just give a story, no? Since you are, let's just imagine that the red blood cell is a wife, then the plasma, or let's say the plasma is the husband. So if, for example, the wife is letter A, the husband will hate letter B. Okay, it's like that, because plasma, the antibody, are actually the ones that cause the clotting. But anyway, let's talk about that. So I hope that's clear. It's an analogy that I just created just now for you to really understand. So I hope it's accurate. No, but anyway, so remember again, the red blood cell is a wife, then the plasma is the antibody, no? It's like the bodyguard, no? It's the antibody, is the husband. So if the wife is letter A, the husband will hate letter B because he loves his wife. So if, for example, let's move on to the next type. If the wife is letter B, then the husband will hate letter A because he wants letter B. Okay, it's like that. I hope it's clear. While if, for example, I don't know how to make the story now with the next one. If the blood type is AB, there's no, like, maybe let's talk about na, maybe, walay antibodies because you cannot love two things. That's the downfall of my storytelling. No? But anyway, just to make sure, no, if it's AB, there's no, your husband na lang, or let's say, your husband will not hate A nor B because you contain both characteristic. Okay? So, meaning, your husband will just be okay with A or B. But if, for example, the wife is type O, the blood cell, or let's imagine the wife. The wife is type O, so that the wife has no characteristic A or B. So, meaning, the husband will hate A or B because it doesn't, that's a thing. No, I hope it's clear for you. So, I'm happy that I made the analogy quite okay. So that's clear, right? I hope that's clear. I can't hear any response from you, but I hope that's clear. So now, why would it be? Remember this one? It's actually an antibody serum. Anti-A serum. Remember? I can't zoom it right now. But since it's like that, so meaning, if, let's focus on the first example. This is a blood type A. Obviously, it's a blood type A. There's a clot in the blood type. Am I correct with my example? Yeah, I'm correct with my example. This is the the color blue solution is actually an anti-A serum. So if you drop this to a blood type A, syempre, there will be a clot because it contains the characteristic anti-A, so the clot will be on the A. While if the anti-B solution, if you drop it to the blood, since this is an anti-A, let's go back, okay? Remember, if you're a letter A, your husband will will only have the characteristic to hate letter B. So meaning, if letter A ang gibutang, in English, if, for example, if you place the plasma to letter A, it will clot. It will be destroyed because they hate letter A. Because, I hope that's clear. So anyway, it's very difficult for me to explain in this way, no? Especially, I really like making sketches and drawings. So that's a thing. I hope you can remember that. Let's go back to this part. So, what's the significance of this? Blood plasma usually contains the said things, no, na the antibodies called agglutinins that reacts with the A or B antigen if two are mixed, as we mentioned earlier. And these are the anti-A, B, C, and reacts. Like, it's the one that I explained earlier. Actually, it's the same thing, no? So, whenever, in this example, you can see that, for example, you have a blood type A, your, you're compatible. Move to the next, check the compatible donor blood. You can be given a blood type of A or O. Okay? That's a thing. If your blood type, you're incompatible with B and AB. I'll try to explain that later. If ever that you're a blood type B, you're compatible obviously with letter B and O. Then, you're incompatible with A and B. AB, I mean, sorry. Then, if you're AB, you're compatible to A, to B, to AB, and to O. And you have no incompatibilities. While you're blood type O, you're only compatible to letter O. And you're not compatible to, there could be a hemolysis if you're given blood type A, B, or AB. I hope that's clear. So meaning in this table, it may signify that the letter O is the universal donor. As you can see, you can give all the blood type letter O to all the blood type, no? While the AB is the universal recipient. It can accept all the blood type. But usually we don't do that in the hospital. We usually search for the exact blood type for the patient because we don't want to take the risk. Okay? But if ever that the event or the scenario is that severe, you don't have any choice but to apply this principle. Because if ever, let's go back to that table again. If ever I'll give the patient, let's recall, okay, blood type A only compatible to A and O. Because if you give the A, obviously that's a compatibility, you know. If you give B, the letter, it will cause clot. And if you give O, it's okay because there's no, there's quite compatible. I'll tell you, I'll try to make a drawing. I'll try to make a sketch on how to understand this. Also, I'll tell you, though it's not really part now here. I'll just check. No, the next topic will be about the heart. So I'll also tell you about how to check if you're, for example, say I'll give you an example since we still have few minutes. For example, I'll just give you a story. No, there was this foreigner who approached me while I was having my vacation because I don't know, maybe he noticed that maybe I'm medically inclined, and he asked me, Doc, no, actually he didn't address me as Doc, no. He asked me, Sir, can you help me? I'm very confused. I'm very mad. Actually, the tone of his voice was not okay. Now, because his wife had a child, and then later, because the child got sick, they realized that the blood type of the child is O. The blood type of the blood type of the foreigner, the male, is A, while the blood type of the female as well is A. Both of them are A, and then the child is O. Now, his main concern is he my child? Is this my child? I checked the child, no, the picture. Syempre, I asked, right, it looks like it's your child. Okay, foreign man. So, I cannot really say na it's not yours. But I can tell you something on how we identify because it does. I know you're expecting for a blood type A child as well. So, that's a thing that I will be talking to you. I just need to make some sketch or drawing. I'll try my best to figure out how to discuss that in a manner that you would understand. Okay? So, I think I will end my lecture here. Forgive me for a lot of stories, but it's very important for us to repeat specific topics because these are very important. I really tried my best to summarize most of the things. I even placed pictures na lang for you to comprehend better, but it's not enough. But anyway, I hope this is clear. If you have questions for this topic, please ask me so that there's no, I actually communicated to few of you, so don't feel shy or feel awkward. I'm just waiting for you to chat me for any questions or concerns so that everything would be clear. Okay? So now that's all for now, no? And say lang, if you have questions, just feel free to ask me. And also, I also have another concern, no? Yeah, tell me if ever that if you want me to discuss about ECG. And yeah, the quiz will be, let's talk about the quiz soon. Okay? That's all for now. Have a nice day.